Chain Drug Review, and Mass Market Retailers Video Forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wolt, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today our guest is Steve Anderson, President and CEO of the National Association of Chain Drugstores, and we're here to mark an important victory for NACDS and all of pharmacy. Steve, great to have you with us.
Hey Jeff, great to see you again as always.
That victory that I alluded to, of course, was PBM reform, which was included in the Consolidated Appropriations Act that was signed into law last week by the President. Maybe you could begin by just telling us what is in that measure that pertains to pharmacy and why it's so important.
It was a nip and tuck, it was a close vote. I mean, the final vote in the House was 217 to 214. It passed easier in the Senate, 71 to 29. But, our members really stepped up to the plate. In the last 2 weeks before the vote, our grassroots network that we call the NACDS RX Impact, which are, our advocates, pharmacists and non-pharmacists that we have with our member companies and other organizations, we submitted 10,000 communications to Capitol Hill, which was really, really pretty incredible. On the provisions of it, it's mostly focuses on Medicare in the commercial market. So in Medicare, it really strengthens the pharmacy access and patient choice by requiring the Part D plans to allow any willing pharmacy to, if it accepts the terms and the conditions of the contracts, and it directs the HHS to set standards for ensuring that the pharmacy contracts are reasonable and relevant and backed by a CMS complaint mechanism which gives enforcement authority to CMS, which is really, really important. It also modernizes the PBM accountability by limiting PBM compensation to only reasonable and relevant fees, which is really, really a big issue. And it's backed by this CMS complaint process moving forward. So it's really good. It adds it provides $188 million for CMS to enforce these provisions, which is very important. So, and then it goes into the commercial market, and there are certain PBM standards there related to group health plans and others. But it's a big win, but it's not we're not done yet. I found it interesting, the statement that came out of the PBM Association. Their approach now is saying, well, this is settled, let's move on. And I think this is far from settled. We have a lot of other issues that we need to work on PBM reform. And so it was a big victory, but we're putting it in balance. And, I told my team, it's like winning an NFL game. You can celebrate that day, that night. Tomorrow we kind of start all over again.
When do these provisions go into effect?
Well, they go into effect over a period of years. So basically, it starts in terms of CMS has to solicit stakeholder input on developing standards on April 1st of 2027. So that's next year. And then the finalized standards will be available on April 1st of 2028. So, these things take a long time to get implemented. You have to have the mechanism created by CMS to do these things. But, like everything else that we do, bills get enacted into law. But the real work is by our staff and by our members is working with the agencies, making sure that they are following the law and making sure that, the intent of the members of Congress is reflected in the comment period and the proposed regulations and then ultimately the final regulations that really implement this.
Well, you weren't kidding when you said you can celebrate for a night or a day and then get right back to it.
Yeah, there's no shortage of issues coming out of this administration related to our to pharmacy, but we knew going into 2026, after we had a board meeting in New York after then President-elect Trump won the election, and then before he was sworn in. But we were really geared up for Trump 2.0, and everything we learned in Trump 1.0. We applied those techniques that we developed to work with that administration. Now, granted, it was almost all new personnel coming into the administration. There weren't too many that were carried over from the previous administration, and surely not at HHS. But we were ready to go, and I think our team has performed extraordinarily well. And I've always said that the strength of NACDS falls with our board. But also we have, many committees, councils, and task forces. So, we talk to our members every day, either individually, one-on-one, small groups, or in these large committee meetings. And we have a pretty good sense of what we should be doing.
Steve, you said there's still work to be done vis-a-vis the PBM industry. What are the next things that you're going to try to get enacted in D.C.?
Well, there's actually a lot going on in terms of what's happening in the states. But this was really important because this really had a profound impact on Medicare and the commercial market. It was the shortfall of this bill. It did not include Medicaid. There was a scoring issue at the Congressional Budget Office that was something they couldn't resolve. As you may recall, the reason they passed these consolidated appropriations was to open the government. The government had partially closed down for those agencies that were part of this appropriations bill that were actually enacted. So now we have to really work on the Medicaid part of that because, as you know, PBMs have found negative impact on pharmacies in many different ways, but particularly in Medicaid. Kind of reminded you go back to probably the Deficit Reduction Act back in 2005, and you remember the impact that had. And that was kind of a bookend based on this one because there were so many onerous provisions in that bill. And we got an injunction that lasted 3 years that were then implemented in the Affordable Care Act that we got those changes made. And this kind of reminds me a lot of that. You win a bit, and I think that saved about $3 billion in cuts. But, the work that we're doing now is very similar in terms of what we need to do moving forward. And that showed the impact that Medicaid will have on this. But they couldn't get those issues resolved in time to get this thing enacted so they could open the government, which nobody wanted another government shutdown after the last one. And that's why this was fairly bipartisan when it started. But then when it gets to when there are county votes and the margins are so thin in the House of Representatives that the Republicans have in their majority, and they couldn't afford to lose very many Republicans to get this thing enacted. So there's so much complexity. We've talked forever about the hyper-partisanship and the chaos in Washington, but we threaded the needle on this one and got it done.
Do you feel that this might be a turning point, though? Now you had a majority of Congress and the president all behind PBM reform. Might we have reached a point where it becomes easier to enact future reforms?
Yeah, I think so. A lot of times it's sort of like, okay, we took care of that issue for you. We're going to move on to some other industries and some other associations. But, our strength is, we keep going. We don't rest on our laurels very long. And we're out there every day. And the good news is these issues are traditionally bipartisan. I mean, we lost Democrats who didn't vote for this measure because it was an overall appropriations bill, even though they were our best supporters on the Democratic side, as an example. And, so it gets complex from that point, and it depends on the political dynamic of where the bills that we want are included, because nothing really passes and gets enacted as a standalone bill anymore. We've been fortunate because of our hard work that we do and our great members and our staff of having these issues in there. So they're bipartisan, and I think that will carry on. We have our large fly-in in Washington D.C. The first week of March, and as you may remember, last year we did this rally out in front of the Capitol building, asking members of Congress to pass PBM reform. And I think now we've got a great opportunity to go in and say thank you to those that voted for this bill. If they didn't vote the bill and they overall supported PBM reform in this different political dynamic, we thank them too, because it was helpful to get us to where we need to get. But so there is a real understanding, and I think it's a work that a lot of what we've done over the last couple decades in terms of branding and enhancing the image of the industry moving forward. Where pharmacy was unrecognized really as part of the healthcare system, and now we're a central part of it. We truly are the face of neighborhood healthcare. And COVID had a big impact on that, and the impact and what the whole industry did, which was historic and miraculous in terms of opening the country and the economy. So there's all those different things that come together in terms of the perception that members of Congress have in pharmacy, and we're attempting to move forward on that very aggressively. So
I suppose it's also true that with a number of pharmacies closing, and we're seeing that number rise, they're hearing from their constituents a bit about the importance of pharmacy in their neighborhood.
That's definitely true. We're losing 6 pharmacies a day. We've lost 2,000 in the last year, and that that impacts their local community. We're working very closely with the Trump administration, and I was over the White House with about some other people in the East Room a couple of weeks ago, talking about the Rural Health Transformation Program. And, pharmacy is going to play a major role in that effort. But we can't do that if we don't have the pharmacies if they've closed in those communities. And, when those pharmacies close, they traditionally close in rural areas and in underserved areas, which is where we need to do this. So we've been working for the states. There's $50 billion that it's been allocated for this. The states have submitted their plans. They submitted to CMS. CMS approved some, and this will be, a 4 or 5 year plan moving forward. And pharmacy is a big role in those state activities in terms of these grants that are going to be coming in, and we're working with the ones where it isn't as well. So it's all connected. I mean, we can't have closed pharmacies if the Trump administration and members of Congress want us to do more. So it's all coming together, and I think this is probably just our first opportunity of a victory that we've achieved, that we'll achieve with ECAPS, the provider status legislation moving forward, and other issues, and it'll help us, I think, with the Medicaid. I think if we got this done now with the commercial market and Medicare, I think we'll have broad support in making these changes to Medicaid as well.
Steve, let me ask you a final question. Earlier you mentioned activity at the state level that's beneficial to pharmacy. Tell us a little bit about that. And I understand things move a little quicker in the states than they generally do in Washington.
There's a lot going on. I mean, I think since 2017, there's been 220 PBM laws, not just introduced, but actually enacted into law. And then you have enforcement issues at various levels in the states because they got less money, and the PBMs have been, very aggressive in going out and fighting each of these state bills. So we're very strong in state relations. We have state directors in the states who know their states extraordinarily well, and we have this as big of a grassroots effort at the state level. Because they can actually get to the state capitol pretty easily to advocate on behalf of the industry. This is going to be a historic year, and I think a very good year for pharmacy in terms of advocacy at both the federal and state level.
Steve, that's good to hear. It's been a long fight, and you guys, again, congratulations. And thank you for sharing your insights with us today.
I appreciate the opportunity, as always. Thanks very much, Jeff.